Hi everyone, my name is Samantha Cunzo, and I will be talking to you about total laryngectomy and tracheostomy treatment options for speech and communication. Let's start with what a total laryngectomy is. This is removal of the voice box or larynx and includes removal of the hyoid bone, epiglottis, thyroid, arytenoid cartilages, and cricoid cartilages. This is achieved through a surgical procedure known as a tracheostomy. In a tracheostomy, a small incision is created in the front of the neck just below the Adam's apple, and the trachea is bent forward and attached to this incision to create a permanent tracheostoma. The pharyngeal walls are medialized and surgically joined with the hypopharynx and upper esophageal sphincter as well. This is caused by head and neck cancer due to prolonged alcohol and tobacco use. It is especially debilitating as it affects speech, swallowing, and respiration. Tracheostomy is characterized by complete separation of the airway and digestive tracts. During the assessment phase, we want to interview the patient and get a feel for their lifestyle to see what communication method will be most effective for them. We also want to assess swelling and other surgical complications that may impact our decision. Treatment is achieved through alaryngeal speech or speech achieved without the use of the larynx. This includes three options for the patient: artificial electrolarynx, esophageal speech, and tracheoesophageal puncture. The artificial or electrolarynx is the most common. It is a small handheld motorized device that uses oscillations to mimic vocal fold movements. It may be placed on the cheek or neck, which is ideal for immediate use after surgery as the patient may place the device in the least irritated location. It is limited by the monotone and robotic voice quality, which tends to sound unnatural. Esophageal speech is when sound is generated by the upper esophageal sphincter. The patient brings air directly into the esophagus and expels it in a controlled manner using the UES as the filter to generate the sound. This approach is limited by the shortness of utterances due to insufficient air supply, as bringing air directly into the esophagus is a difficult skill to master. It is, however, becoming less prevalent due to the development of the tracheoesophageal puncture method. The tracheoesophageal puncture is the most favorable method as it involves a one-way valve that is placed from the trachea into the esophagus. This allows for esophageal speech to be achieved using air supply from the lungs. This allows the patient to have the most natural-like speech and have regular conversational utterances. The tracheostoma must be occluded when speaking to achieve audible speech. And here are my references.